my name's Morgan Sly. I'm part of Moorhead's RN to BSN program. I've been a registered nurse for approximately 4 years. Most of my background is in ER, with the last year being in progressive care. I actually did my practicum on the cardiac progressive unit on the 6th floor here. So it was very interesting because I have a little bit of a cardiac background, but not as significant as what I experienced actually on the unit that I went to. So it was fun, it was different, and it was very important that I got that knowledge. So I'm really glad I chose that unit. So I actually decided, me and my preceptor, we sat down one day, I think it was the first day, and we decided that the biggest issue that we felt needed to be improved or focused on was fall prevention. So that was a pretty broad topic, which I think it applies to most every hospital that I've ever been a part of and affiliated with. Everybody needs to improve on falls. Just one fall is really too much, so it can be detrimental to a patient. So I'm just going to basically keep my papers here just so I can look at the main points to touch on so I don't forget anything. Excuse me. So some things that cause falls, it can be a multitude of different factors, but just to name a few: immobility, altered mental status. This can be like an elderly patient who maybe has like stroke-like symptoms, or maybe somebody who is abusing substances or going through like alcohol intoxication. Vision problems can increase the risk for falls. Just unsteadiness, like patients with Parkinson's are actually at an increased risk because of the shuffled gait. And something else that I feel like kind of gets overlooked is like urgency to void, or if a patient has had a bowel prep. That seems to really play a huge role in increase of falls because they're having to use the bathroom. And I've really learned through this research that sometimes that can actually be the number one cause of falls, is just a patient trying to get to the bathroom in time and maybe thinking that they can do more than they really can and failing to press the call light, or I'll go over barriers later because this kind of falls in with the barriers, but just the staff not being able to get there quick enough, maybe because they're in with another patient, or they've had a call in and they're short. The ratios, it's a very demanding field, so that's definitely plays a big part. But as nurses, we're the front line of defense, so we're very important, and we rely heavily on our care techs too to help us out. I think the most important thing that we do for our nurses is educate, and UK is awesome because on the first day of orientation they tell you how important fall prevention is. You have a whole PowerPoint, couple hours allotted to just fall prevention, so they do a really good job, and I really like being a part of this hospital. Prevention is the key. You want to definitely make sure your nurses are educated on different measures that you can take to prevent falls, and you need to keep, there's new research that comes out all the time, so you need to keep that really up to date and really go with what the evidence says. Some different things that we do here at UK and I'm sure throughout all the other facilities as well: non-skid socks on everybody. Great idea. Bed alarms. So if the patient is, I think it's greater than 12 here at UK, if we get in our charts and we fill out a fall risk assessment for every patient, every time, every shift. If they're greater than 12 on that fall risk, then they're high risk, and the bed alarms need to be set. We need to place a fall risk sign on their door. We need to place an armband on them. And another thing that's kind of universal is we always make sure the bed is low and locked to the floor, and if the side rails need to be up, raise them up. Something I was actually really surprised about whenever I did this research project was the height of the bed is the most important issue in fall prevention. And I don't know why that took me by surprise, but it makes sense, because if a patient's, I guess, not low to the ground, if they're not like at a complete, perfectly straight angle, then they could slip. And I think that that definitely does make sense. So in my paper, I actually touched on different units because I wanted it, fall prevention so broad, and it affects every single unit, no matter where you work. It's going to affect every unit. From an ER standpoint, it's hard, because different hospitals have different ratios. It is imperative that you communicate with the family, with the patient. We have this going on, so we might not be back in the room for a few minutes. Please press the call light, and you always tell everybody, call, don't fall. That's a pretty universal little slogan. But ER, like I was saying, not to get off track, but you might have a patient who is an elderly patient, or like especially the little patients from the nursing home, who are just lonely and want somebody at the bedside at all times. And then you might have a code come in, so you might not get back into that room for a while, and then before you know it, your elderly patient has stood up and slips and falls and gets a head bleed. That's why it's just so important to communicate and to make sure, if you need somebody to sit in the room, then by all means, do what you have to do to make sure that these patients don't fall. As a last resort, restraints. They will sometimes start with chemical, but eventually some patients do have to be physically restrained, which is like I said, a last means, but it has to be done, especially with these little confused patients, because they will fall and they will hurt themselves, and the older they are, the more at risk they are for actually dying from these falls. So if you need restraints, you need to get that order in, and you need to get that patient restrained, and that's kind of goes with every unit you're on. ER is really easy to get restraints, and the patients aren't in there very long, so they're not in too much harm. But whenever you're like on the floor, like the floor that I did my practicum on and the floor that I work on, we commonly have to get restraints, and you have to make sure you round on these patients at least every hour, because they can be very dangerous. So that's something to keep in mind. But another thing I want to touch on that's very, very important in fall prevention is teamwork. I mean, interdisciplinary collaboration is the new big thing, and it is so important because, we have at UK what we call boost rounding, and the doctors and the pharmacists and the physical therapists, occupational therapists, nurses, techs, they all go into the room every morning and round on the patients, and this is a perfect time for the nurses and the physicians and everybody to communicate what this patient needs. What do they need? Is this patient, do they need a patient companion, what we call a sitter, who will sit in the room and just keep them company? Because that's really all some people want. Others are just, there's a million different reasons why people would get up and, potentially put themselves in harmful situations, but communication is absolutely key, and that's just with everything. But needless to say, I chose to do my CUSIN competency. The one I chose was safety, because safety is the number one priority in healthcare, as it should be across the board. It directly relates, and I have like the little thing that I wanted to read to the CUSIN, defines safety as minimizes risk of harm to patients and providers through both system effectiveness and individual performance. Okay, so if we keep our patients safe, we're doing a good job, because at the end of the day, what we want is no harm, okay? Because these patients are already sick, they're already in here, they don't need anything else to go wrong for them. Some of this, it can boil down to life and death in some instances, so you just have to be very, very careful. Another interesting thing that I discovered in my research was open-minded nurses who are more willing to learn and keep up with evidence actually have a higher chance of preventing falls. And it's just like talks about how a caring attitude can actually make a huge difference, and evidence shows that it does matter and it does aid in fall prevention. Some barriers, like I touched on earlier, time management skills of a nurse, very important. And I guess the more experience you get, the easier this comes, because they can't really teach you that in school. That's something that you kind of have to learn on your own. But time management, very important. Nurse-patient ratios, oh my gosh, this is so critical, and this is a huge problem everywhere. It just, sometimes you feel so overwhelmed, and like not everything can be done in one day or in one shift, but this is why you have to ask for help. Regardless, if it's a tech, another nurse. At UK, we're very lucky. We have good ratios, okay? On the progressive care units, it's 3 to 1, 3 patients to 1 nurse. And sometimes we even get a resource nurse, which is amazing, because we have some people to lean on if we need help, and that really works in our favor. Workload, that kind of correlates with the ratios, just depending on how sick your patients are, you know. Let's see. So a benefit that I want to talk about is technology. We're very lucky here, once again, at UK. We have state-of-the-art technology. I work on a brand new unit that was just opened last May, and it is just amazing how much technology we have access to. So now we actually have cameras available to us in every room. We have central monitoring, which will actually call us. They'll watch patients sometimes if they're high risk, and they'll call us and let us know, hey, your patient's up, like, you know, do you want to check on them and make sure that they don't fall? We can access those cameras whenever we want. It's very nice. Let's see. Another thing that I wanted to discuss was how cost effective it is to prevent falls. When a patient falls, you know, they're automatically going to need scans, x-rays, sometimes interventions and treatments, which cost more, okay? Increased length of stay. Medicare actually no longer reimburses. This has been going on for a while, so this is really nothing new, but they don't reimburse acute care facilities if a patient falls. And some little things, you know, just for example, some little things that you can do if you know a patient is going to be high risk, or say they're going to get a medication that might make them drowsy, Dilaudid, Ambien, morphine, just to name a few, blood pressure medications. Make sure you reorient them and tell them not to get up, you know, press the call light, let us know, scream out if you have to, don't get up without assistance. Just make sure they know that you're available for them when they need you. So, let's see, make sure I didn't miss anything. So, research actually shows that nurses perceive the greatest barrier to fall prevention strategies as a lack of knowledge, availability of support staff, access to equipment, and the health status of a patient. I would have to agree with these just based on my own experience, and I thought that was very interesting. And just to wrap it up, the future really focuses a lot on nurses directly, their direct role in prevention and education, because we really are the first line of defense and prevention in these falls, because we're with our patients all the time, and we rely heavily on our techs. So techs are wonderful, so always be good to your techs. And I think that's it. Thank you.